Okay, fantastic. Welcome, everybody. My name is Michael Johnston. I'm the CEO of the United Way of Western Connecticut. I want to thank Childcare Learning Centers today for allowing us to hold this event here, and we're going to talk a little bit more in a few minutes about why they deserve great congratulations today. We have some special guests that I'm going to be introducing in just a minute. And it's really an extraordinary day for us when we have a chance to be able to acknowledge organizations in our community that do extraordinary work in areas that we're very interested and concerned about at the United Way. Many of you know that the United Way has recently committed itself to joining the effort of fighting childhood obesity in our communities. It's a very serious issue for us, and it's probably not too much to say that it's a national issue, but one that has significant implications for us here in Connecticut, for our region, and for the city of Stamford. You know, every generation in our country has lived by the concept that they will have a longer, better, stronger, healthier life than the generation that has preceded them. We fear that some of the obstacles to our youngest generation, and particularly in the area of childhood obesity, really pose potentially significant obstacles to achieving that. And as the United Way continues to think more and more about preventative investment that allows us to tackle problems in our communities in ways that prevent problems from growing more serious or from occurring at all, I can't think of a more important initiative, more important area than the area of childhood obesity. You know, we often think about childhood obesity, but we don't often hear the statistics as clearly perhaps as we should, and there are just a couple of statistics that I wanted to mention. You know, 1 in 4 high school students are overweight or obese. Among low-income children between the ages of 2 and 5, which is a very important age for the development of kids, obviously, in Connecticut, 16% of those kids in low-income families between the ages of 2 and 5 are obese. We also know that there's a state standardized physical fitness test in our public schools. And we know that only about 25% of the kids in our public schools are passing that test today. In some schools that serve low-income communities, that percentage is as low as 10%. So imagine a community in which some of our most at-risk children are not receiving the right kinds of physical fitness activity, the right kinds of education around nutrition. Those children are really at risk. We usually think of this issue as a health issue, and it certainly is, but it's more than a health issue. It's also an economic issue for us. There is great potential, if the pattern of activity continues the way that it has been going, that our healthcare system is going to be buried in an avalanche of healthcare obesity-related costs in the future. So when the United Way thinks about this issue, we certainly think about it in the way that it challenges our children's future, but we also think about it as how it could potentially challenge our long-term economic outlook, and that's an important issue for us as well. Today, however, we're here to talk about the United Way trying to do something about that, to help turn the tide in the effort on this particular issue. You know, it's a wonderful opportunity for us to, if you will, put our money where our mouth is. We want to talk today about investing some dollars that we've been able to raise from a very generous individual donor to invest in childhood obesity causes in our community to help, in fact, turn the tide. And I cannot think of a more appropriate person today to help us to announce the grant of the award today than Congressman Jim Himes. And I know he's committed to this issue because I have heard him speak at town hall meetings on this issue very eloquently. And so we're very, very pleased to have Congressman Jim Himes here to help us with the grant award. Congressman, come up. And by the way, I just want to point out that you apparently received a promotion today from the children here at the school. Thank you very much.
That would mean I'd need to run every 6 years instead of every 2. So thank you for whoever who granted me that 4-year reprieve. I'm just thrilled. I'm always thrilled to be here at Childcare Learning Centers. Every time I come, no matter how tough the day has been, it makes me feel happy to be in this place where such great things happen for deserving kids. But today is particularly special because, and Michael said it far better than I could, we're here to celebrate and to thank and to enjoy the fact that this wonderful organization, CLC, is going to be given the resources they need to address a very serious problem amongst our young people. And by the way, I say that not as a congressman, but as a dad of 2 young girls. And let's face it, we know what the world looks like for our kids today. A lot of us grew up playing sandlot baseball and getting shooed out of the house by our parents. You know, today it's all about the Wii's and the online and sitting in one place for a very long time. As Michael pointed out, some of our children living in circumstances of urban poverty, there is no place to play, to get out and run around and play that sandlot baseball. So this is a serious issue. And it is, both about the individual. I mean, can you imagine being this age and already developing chronic illnesses that make you perform less well in school, that give you a less likely opportunity to go to college and to really live the kind of full life that we want for all of our children. But the costs to our medical system, and this is a topic much discussed these days, associated with the epidemic of obesity in this country, are mind-boggling. Just mind-boggling. And so it's a real thrill to be here to celebrate a very generous donor, the United Way, who has really picked a terribly pressing and important issue and now has done something very big about it by granting this $150,000 contribution to a very, very worthy agency. Barbara, thank you for what you do. I know we've got lots of CLC staff here. Thank you for what you do, and I just can't think of a better recipient for this amount of money. My understanding is that this is going to touch something like 1,000 children. And so the United Way CLC, the donor who is behind this, has really made a difference in this world. And thank you all. Now, I guess I'm supposed to hand a check or something.
So Barbara, why don't you come on up, and we're going to hand over the check here, and why don't we perhaps just step to the side here, and we can hand you this check and do a little bit of the congratulations.
Now, on behalf of the children of Childcare Learning Centers, first of all, I want to thank United Way, and especially the volunteers from United Way, as well as Congressmen. We're exceedingly proud of this recognition, and we're looking forward to expanding this truly great program so that we can end childhood obesity and expand this program and reach out to the rest of the community. I especially want to recognize Sonia Calapaz, who couldn't be here today. Her daughter got married this week. She is our development director. I want to thank her, and Penny Lehman, our program services director. These two spent hours putting together the grant and getting it submitted for us, and so we appreciate their efforts. But most especially, I want to recognize the leader and the creator of the Healthy Bodies program, and that's our nutrition manager, Victoria Pittman-Green, for all of the help. And now it's my pleasure to introduce the children with Classroom 5 and their teachers, Jackie Copeland, Margaret Ray, and Amy Smith. The children have prepared 2 numbers for you, Ball in the Jack and High Five. Hand jive, I'm sorry, thank you, okay.